In patient number 2, a patient 2 days post-renal transplant that is complaining of no urinary output, that is not expected or unexpected. So in other words, a chronic expected condition, when I compare it with an acute unexpected condition, the priority will always be an acute condition with unexpected symptoms or complications. This is a keyword, this is a strategy that you can use in priority questions when they give you 4 patients, what patient you will see first? The patient that has an acute condition, that is showing unstable vital signs, complications of that condition, instability, airway, breathing, compromise situation, that is going to be your priority. So the correct answer is B. All right. Third scenario. You have a patient with COPD and you have another patient with appendicitis. In this case, patient A is a patient with a history of COPD, now complaining of difficulty breathing and an oxygen saturation of 85%, versus patient B, a patient with an acute appendicitis. What is the priority? Do I give the priority to a patient with a chronic condition such as COPD and an oxygen saturation of 85%? Or do I give a priority to appendicitis? What is it? See, this may seem easy, but it's rather difficult. And this is just a practice scenario. This is just a little warm up. This is why I tell you that it's important to develop this ability. So what do you think? All right, I see some of you telling me patient B, some of you telling me patient A. So how do I prioritize this situation? Because both are critical, both are important, but I need to find out the most important. The most important patient is A. Why? Because this COPD, which is a chronic condition, now has a change in condition. And the change in condition is an oxygen saturation problem, which means that there is airway, breathing compromise. Yes, appendicitis is very critical. I understand that. But it's not airway breathing compromise. And for the NCLEX, you need to understand Maslow's hierarchy of needs. Maslow's hierarchy of needs says that if a patient is unstable and has an airway, breathing, circulation compromise, that patient has the priority. So although COPD is chronic, now because it's presenting with difficulty breathing, means that there is an exacerbation process going on. And that exacerbation process has to do with airway breathing, and that is the priority over acute appendicitis. Now, of course, in the real world, it's not like you're going to be waiting a whole lot of time with a patient with an acute appendicitis. This patient needs to go to the operating room.